again?
Absolutely, from the top. Okay, everybody, today we'll be going over the gluteals, right? And that is the gluteus maximus, gluteus medius, and gluteus minimus. Please don't forget that when you put your hands, let me adjust this back down here. When you put your hands way down here, most posterior is your gluteus maximus, then kind of on your sides, gluteus medius, then a tiny bit in front is gluteus minimus, and then tensor fasciae lata. Gluteus maximus, gluteus medius, gluteus minimus. Tensor fasciae lata is not a gluteal muscle, but I like to throw it in there because think about it when you guys are massaging, you're going to work around the crest of the ilium. You want to know that you're going by the gluteus maximus, the gluteus medius, the gluteus minimus, tensor fasciae lata. And by the way, rectus femoris comes after that and all sorts of stuff. But anyway, the point is you've got to have that kind of thinking. It's why I keep, by the way, drilling in the thing about the medial border of the scapula. Because when you're running your hand up there, I want you to realize you're going by rhomboids major as you go superiorly, rhomboids minor, levator scapula, right? I want you to kind of have that stuff so when you're tracing along a bone, you know the stuff you're passing by. Make sense? Thank you for reminding me, Mr. Tate, by the way.
You're welcome.
Somebody's got to keep me in line here. So, glute max, med, min, right? Yes. Miss Lobitz, what are the three gluteal muscles?
Gluteus maximus, medius, and minimus.
Which one is the largest?
Maximus.
Which one's the smallest?
Minimus.
Which one's most posterior?
Maximus.
Which one's most anterior?
Minimus.
Which one's probably most lateral?
Medius.
Excellent. Thank you very much, ma'am. Awesome, awesome, awesome. Mr. Riedel, what are the three gluteal muscles?
Mr. Riedel?
Yes, sir. I almost answered that. I was like, I'm not Mr. Riedel, you're Mr. Riedel. Yes, sir. What are the three gluteal?
It's maximus, medius, and minimus.
Yeah, what maximus?
Gluteus maximus.
Gluteus maximus, medius. Which one is most posterior, sir?
Maximus.
Yes. Which one is most anterior?
Minimus.
Yes. Cool. And which one is between those two?
Medius.
Yeah. All right. Cool. Thank you, sir. So everybody, I am oversimplifying, and as we go through the slides, you're going to see that I'm oversimplifying, and I'll explain where I oversimplified, but I also like to pack away little bits of information in my head that makes sense that I can utilize everywhere. So everything I'm about to tell you is true, but there is more to this truth. But let's talk about the basic actions of these muscles. We're going to find out they're a little bit more complex than this. But if my gluteus maximus is on my back side, what is a very likely action that it has? Anybody?
Is it extension?
It is extension, sir. It's extension of my hip. Thank you very much, sir, by the way, because extensions in general happen on my back. I love that. If my gluteus minimus is in front a little bit, what is one of the actions that it could do? It's in front. Somebody else. Who said that? Oh, Miss Sarno, yes. What'd you say? Flexion is right. She's right. It's in front. By the way, there's lots of strands to the gluteus minimus and medius, so it can do other things, but the fact is it's flexion, so it is a hip flexor. Yeah? So who can tell me, if it's a hip flexor, what kind of tilt can it cause in your pelvis? Anybody else?
Anterior.
Anterior tilt. So we know some other muscles that can create anterior tilts. We know some other muscles that can create anterior tilts.
I'm sorry, I was shaking my salad.
I love it. It's very you. I don't know why. In a nice way, I mean that. I don't mean like, it's just cute. There's always, a little extra silliness.
Because I'm shaking my salad or yelling in the bed. I'm sorry, y'all.
We'll take shaken. We'll take shaken. Yeah. So we now know that the rectus femoris can create an anterior tilt. And we now know that the gluteus minimus can create an anterior tilt. And I definitely know TAPSAT's going to love this as a question eventually, which will be, what are your hip flexors? What are the muscles that can flex your hip and thus create an anterior tilt? Because remember, that's a big problem for people when they have back problems, is they often have their hips tilted forward, and that's what's really causing the problem with their back, right? So gluteus minimus is one of those. Yeah? So somebody else who hasn't answered, what action would the gluteus medius, which is on the sides of my body, possibly create? Saw somebody mouth it. Yes, Miss Routson.
I could be wrong, but I've been trying to exercise again,
Yeah,
and I feel like
you are wrong. You should not try to exercise again.
I feel like when I lift my leg up to the side, abduction, does it help with that or no?
100%. 100%. Now, don't get me wrong, guys. These guys have muscle fibers that go in certain directions, and there are other things they do. But if you remember nothing more, if you could honestly get, I want you to learn more, by the way. We're better than that. But you would be better than most therapists out there if you honestly just remembered, like, max, med, min, extension, abduction, flexion. Right there. And I don't just mean that would help you figure out problems with people's backs, hips, all sorts, just knowing that. Just knowing that. So please don't ever forget max, med, min, extension, abduction, away, and flexion of the hips. Yeah? That's kind of like, you know how I always like to give you like a little pocket thing. Every lecture you can just drop in your pocket and walk around and be like, yeah, I know that. Cool. Okay, so let's learn a little bit more details about this muscle. I'm going to present my slide presentation right now. Boom. Boom. Okay. Should see a picture of somebody's lower half of their body hiking. Yes. Good. Okay, we're in the right place, right time. All right. Let's go ahead and look at the glutes. Bear with me a second. So this is a posterior view, which means we're looking at the backside view of the right leg, right? And let's talk about the gluteus maximus. Just from this picture, not from the origins and insertions in your book yet, just from the picture here, what would you say the origin and insertion is for this muscle? I'm not looking for the correct answer. I'm looking for the answer that comes from this picture. Like if you look at this picture and kind of say, yeah, it kind of starts here and it kind of goes here. What do you see? Somebody. Please, Miss Estes.
I would say the origin is the iliac crest, and then the insertion is the IT band.
Yeah. Yeah. By the way, the only thing I'd add to that is I think it's the iliac crest and the sacrum. Like it goes down that far. But I'm not trying to correct you. I'm just trying to, yes. And so, so we know that you guys have an aponeuroses in your lower back called the, what do we call that aponeuroses in your back? It's in the lumbar and the thoracic region.
Thoracolumbar?
Thank you, Miss Mejia. The thoracolumbar aponeuroses is in your back, and it literally weaves into the fascia of your glutes. I know it doesn't show it here in the picture because it's trying to show you the glutes, right? But this is just like Arizona on a map. Like, you only know Arizona is the shape of it is because somebody drew it on a map. It has nothing to do with any natural landscape, pretty much. That's not completely true, but close. So anyway, this thing feeds into the thoracolumbar aponeuroses of my back, and then it goes down in the IT band. So it's not a radical idea when somebody has low back pain, tension, to work the glutes and work down the IT band. They are intimately connected. And it's for a reason. It's your body's way of taking weight from your back and kind of distributing it down to your front. It's hard to picture, but it's helpful if all this weight from my back also gets wrapped around the sides of my legs. It helps me support my back. And your body's always trying to channel off weight and stresses to other areas. Not to get rid of them completely, to distribute them. Right? It doesn't want to take it in any one area, so it distributes them. So you really could rub down somebody's back, go over their glutes, and go down their IT band. It would not be a crazy thing to do at all, or vice versa. So don't feel bad about, like, don't start thinking about tying that stuff together. That is not a crazy thing to tie together at all. At all, at all. And you'll notice lots of people with back problems have tight glutes and tight IT bands and vice versa. Cool? All right. By the way, it does insert into your actual femur as well. We're going to find that out. But it's very important to remember that it inserts in your IT band. Yes, Miss Trotter.
So, could possibly if somebody had knee problems, could they also have, because like I know when you have knee problems, it makes their arching band tight, so could that also make their glutes tight too?
Yeah, I mean, I would think so. I would think you have the tensor fascia lata that's designed to tighten up the IT band, but the glutes can tighten it up too because they pull on it. And I would think it'd be a pretty common response of the body. If it was trying to stabilize the knee, trying to lock it down, that you would tense up that whole area. Yeah. Good thinking. That's the kind of thinking we want. Is she 100% right all the time? No, but you'll never will be. But is it really good logical thinking that will be true some of the time? Yes. Yes. Yes, and get used to this, everybody, because we have left the world of correct answers. we have the world of incorrect answers still. You can say something completely incorrect, but like with every client, even if you were the best massage therapist in the world, you're trying to make a logical guess on what to work on. And then if that doesn't work, you try something else. But Ms. Trotter, yes. Will you come across that in your life? Yes. Yes. Really good thinking. Exactly. So notice too with the gluteus maximus here, it really hooks onto the posterior crest of the ilium and the sacrum. And once you're on the side where your hips are, that's gluteus medius. And gluteus minimus is underneath that and a little bit forward, more forward, and I'll show you a picture of that instead too. But just remember, your hips really are your gluteus medius. That's a good way to think of them, in a way. Which is why you feel them when you do little, like, abductions with your hips, right? In fact, in some ways, your gluteus medius is kind of like the deltoid for your hips. And we'll see that. I'll show you that here in a second. All right, let's go. Here's the side view. I do want to point out something about this side view. Your body makes all sorts of triangulations. And so the glutes come down here this way, the tensor fascia lata comes down this way, and they both feed down the IT band. You'll notice that a little bit of glute goes down even further, and that's going to insert actually into the femur. Well, I'll explain in a second. I'm getting ahead of myself here. Don't worry about this, it's terribly confusing. These are the lateral, the deep 6 lateral hip rotators that are found underneath the glutes, right? Remember those? Yeah? Remember their names? All that good stuff? Yeah? Miss Mejia, what are their names?
Piriformis, gemellus superior, gemellus inferior, obturator internus, obturator externus, quadratus femoris.
Yep, and it's cut in this picture on the right, but it's over on the left-hand side, yeah. Good. Love it. Moving right along. Oh, and I probably just threw this in here to remind us about the iliopsoas. This is a great side view of the psoas major coming down here and wrapping around. Okay, let's talk about the gluteus maximus. The main point of the gluteus maximus is to extend the hip, okay? But the fibers run diagonally, right? So because they run diagonally, they can help you to abduct your hip a little bit, and they can help to laterally rotate it, which means to kind of pull it out this way, to actually rotate it out. That's not crazy. If I'm got this skeleton here and I'm in back, I can grab these legs and rotate them out. I can rotate them out by pulling back here. And it sounds funny, but we actually use some lateral rotation when we walk. So, it's going to be hard to see this on camera, but I don't actually walk like this. This is me not rotating my hips at all. It's not very effective. Actually, when you walk, you actually rotate. Now, hopefully you don't walk like this because somebody's going to beat you up. But the point is you do rotate. You don't actually go with no hip rotation. You actually laterally rotate to walk. So, does lateral rotation, and I know the lower fibers adduct because they can pull back in. Honestly, as somebody who's been doing this 26 years, I actually only focus on the fact that number one, your gluteus maximus is the most powerful hip extender you've got, and it's probably the largest muscle in your body. I say probably because it depends on how you measure largeness, but it's probably the biggest muscle in your body, the heaviest. So your gluteus maximus is the most powerful hip extender you've got. It also can also help you with lateral rotations of your hip. That's all I remember. Yes, Miss Mejia.
I don't see, like, what does it mean by lower crest? Does it just mean the ones that are more,
It means the second.
inferior, or what is it talking about?
Yes,
when it
the ones that
means-
are most
Yeah.
inferior, that are more inferior. Yeah, that adduct the lower fibers. Can you see? There's like they're getting really nitpicky, but can you see this is a second set of fibers down here? There's the fibers that go in the IT band, and there's these fibers down here that actually insert into the gluteal tuberosity, which is a bump on your femur. That's right down in here. And those can help to adduct, pull the leg back in if they need to. Yeah, thank you. And this is why I wouldn't advise actually memorizing every last little teeny action on here. And I promise you at the end of the year, I'm not going to be like, what are the 4 different things it does and which fibers do? No, I just want you to know it's a powerful hip extender, and it can also create a lateral hip rotation, which are things that if you visualize it, you should be able to kind of see that, I would hope. So let's talk about the origins. Miss Estes was right, by the way, just looking at the picture. They just describe it really nitpicky here, right? So they say it is attached, it's got an origin on the coccyx, which is your tailbone. An origin on the coccyx here. The edge of your sacrum. The posterior iliac crest, right? Because the middle iliac crest is something else. And the sacrotuberous and sacroiliac ligaments, you don't have to worry about that at all. But let me tell you what they are so we know. So when we look at the skeleton here, we're talking about muscles here, but honestly, there's all sorts of ligaments that tie your sacrum to your hips. Remember, ligaments attach what to what? Bone to bone, yeah. And so your body actually gains most of its strength by ligaments. If we're studying, if there's 600 muscles in the body, there's 30,000 ligaments. Like, there's just a lot. They're everywhere. We could spend a 10-year course studying ligaments. They're everywhere, but part of what they do is tie your sacrum to your hips so that they don't fall off. So this is why when your muscles get really tired in the gym, you might not be able to lift anymore, but your arm or your hips don't fall off. That's because ligaments hold on long after your muscles do. So the sacrotuberous and sacroiliac ligaments, well, let me give you the sacroiliac, for example. The sacroiliac literally attaches the sacrum to the ilium. Sacrum to the ilium. That's what it does. That's why it's called that. So anyway, the glutes are under there and they're attached to that as well. And then they insert into the IT band, the iliotibial band or iliotibial tract over here, and the gluteal tuberosity, which is a bump on the back of your femur. Yeah? Ms. Lovitz, do you have a question or is that just your thinking brain? Okay, I mean your thinking look, you know what I mean? Cool. Sorry, I just used some of your facial expressions to kind of figure out where I'm at. Cool. And that's your gluteus maximus. Yeah? And I think in any normal massage, don't get me wrong, if I come in and I'm a guitarist and I say just work on my hand, don't rub my butt, that would be weird. But in any normal massage, I think you should be hitting glutes someplace in that massage. Yeah, and Mr. Barr is nodding his head. It's like I mean, assuming by the way the client's comfortable with it, yada, 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 but through the sheet I would be hitting almost everybody's glutes, their gluteus maximus for sure. Yeah. All right. So, here's the gluteus medius. It's kind of tricky. Remember I told you that I said it AB ducts, and if you notice up here it says all fibers AB duct. That's what I remember it for. That's why I tend to look at it. Does it have enough anterior fiber up in front to also do a little bit of flexion of the hip like the gluteus minimus? Yes, it does. Does it have some stuff in back that could help you extend and laterally rotate? Yes, it does. But the stuff in back, by the way, that helps you extend and laterally rotate is underneath the gluteus maximus. So when I go to the gluteus maximus, because I'm working on an extension or lateral rotation problem, I'm accidentally hitting the part of the gluteus medius that does lateral rotations and extensions. Does that make sense? That's why I memorize it this way. You don't need to know every last little thing. I want you to remember the highlight of it, actually, in this case. So the point is, when you are working along somebody's crest of their ilium, you go through their gluteus maximus, then you, as you're heading towards the front, you go by their gluteus medius. And this is why I think on every massage too, you should trace under, inferior to the crest of the ilium. You should be going underneath people's hip bones, I think. I think it's one of the most important things you can do. So, this attaches to the gluteal surface of the ilium. Let me show you what they mean by that. Attaches to the gluteal surface of the ilium. So this is your front of your hips. Here's your back, this posterior side. They're just calling this entire surface the gluteal surface of the ilium. And the medius attaches right in here where this red is, and then goes down and inserts onto the, the greater trochanter. That's why this greater trochanter is so big, by the way, is so that muscles can grab onto it and have a huge lever to work off of. And you do have tiny little lines in here, a posterior and anterior gluteal lines, but you do not need to worry about that. We will not be taking an origin insertion test on those exact little things. You just need to kind of remember it lives in here. Yes, Mr. Blige, please.
So I sleep on my side, on my left side, and I'm starting to notice I'm having pain, like in the trochanter area.
Yeah.
It feels like, because I feel like that's the bone that's like protruding out the most when I lay down on it.
It should be the bone that's protruding out the most.
Yeah, hopefully. So what can we do as therapists to help someone alleviate pain? Because it seems like that's where it's coming from. And also, when I was sitting at a computer, I feel like I was like anchoring up on that left side as well, like naturally. So I don't know if that's also adding to the pain. So what can we do? What type of techniques or whatnot can we, or stretches can we do to help alleviate that pain?
Well, okay. I mean, all sorts of things come to mind. One is, this could be one of the simplest problems to fix, because you really might be feeling pain on that literally just from laying on it too long. Just like when you lay on your left side of your body and your arm goes numb because it's pinched underneath your body or whatever. So this really just could be a compression issue. And so literally just doing massage, rubbing it, is really helpful. I like to actually rub all these attachments off the bone. So, you know, as we got this greater trochanter, I like to actually, you know, try to rub muscle off the bone on this greater trochanter, actually find it and get all the, because that's where it gets really sore, is probably right in there. And so, I mean, I know that's like kind of a lame answer, sir, but rub it would be one of my things. Because it might just be sore from you laying on it. And so it just gets achy and all that kind of stuff and rubbing it. But if you were going to stretch it, that's a little bit trickier because this muscle basically abducts, and it can only adduct so far before your legs kind of hit together. But you can bend the body in certain ways on the table to try to get the lower legs to come over further and kind of stretch that thing out and then work along there and kind of pin and stretch in that sense. You know, when we do those big scooping motions where we're pulling across the body? Well, if you do this below the crest of the ilium and wiggle the leg at the same time, you will get incredible action on the gluteus medius and minimus. Incredible action. So I'm talking about when somebody's face down, you bend a leg. You guys are probably already doing this where you put a fist in their glute and do that. Are you guys doing that? Well, reach across, grab the other leg, and bend as you scoop up. And you will get all sorts of stuff. And you can even work the greater trochanter that way. I know you're trying to visualize that right now, Miss Lovitz, but...
Me too. So you're saying...
Do you guys want me to show you with the skeleton really quick? Actually,
yeah.
I've got an idea. I've got my star student next door. I'm going to go see if he's available, and maybe he'll come over here and I can demo on him really quick. Yeah? Okay. Thank you, sir. We'll show you on the massage table. Mr. Ibarra will come over here. We've got an advantage. I love it. Let's get you here. Here we go. Hopefully he's on his way. Mr. Barr, you're coming, right? He's coming. Yeah, he's coming. Okay. He's coming. Trust me, it's worth it. Now, I'll only be able to demonstrate a little bit before he gets in here because I'm so much of a better massage therapist than Mr. Barr that he gets kind of intimidated if I work on him too long. Don't say anything, okay? It'll be obvious, but just keep that to yourself. Anyway, I'm just going to show a couple of points. I'll try to make it sloppy so he doesn't feel too, but you know. Actually, I think he's a better therapist than I am. I just love saying that. Okay. Thank you, sir. I just want to lay you face down.
Okay.
I just want to, I just, you know. It is nasty. Yeah.
I grab it off
Did you blow your nose on it? What'd you do? What are you doing? Oh my gosh. Mr. Barra. Okay. So do we all see Mr. Barra? Yes, we do. Look at him. Okay. So, for example, right now, you guys do stuff on this side where you're doing this, yes? Okay. Let me just make a point. Let me get some tape to make a point here. I think this is a good color to pick. Put that right there. Thank you, sir. So roughly, it's great having you here. I'm going to start doing this all the time. You're good. I don't think that's right. There we go. So this tape here, that's roughly the crest of his ilium. Okay? So above it, this is where the QL is, right? Quadratus lumborum. The transverse abdominis, the internal external obliques are over here. Down here, below the bone, is gluteus minimus, gluteus medius, gluteus maximus. Right? All through here. Yeah? We're used to putting a fist in the maximus and wiggling this around, but of course we would do it from this side. What I'm saying is, I think all of you should be doing moves like this where you reach across the table and pull here. Well, when I'm doing that, I can wiggle his leg from this side too. It's extremely effective. And I can not just work here, I can get kind of on the greater trochanter and kind of use this to push the fascia off the greater trochanter. So play with this in class. This is super powerful. You're tight in here. I know. You're never supposed to do that, by the way, to a class. He's like, I know. So that's what I meant by reaching across and wiggling the leg from this side. And you can do this for hours. There's all sorts of stuff in here to get at. But what I'm doing is, his greater trochanter is right here, and I'm trying to work meat off both sides of it. Not rub it directly, but kind of work the meat off both sides, work around it. And if you wiggle this leg around, you'll feel all sorts of amazing things. But just this stroke alone allows me to hit gluteus minimus, medius, maximus. Just doing this. Boom, 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 boom. Of course, like, if we're skin to skin contact, it's a smooth movement. But does that make sense? Cool. Cool. You can just lay there for a second if you want.
I'll sleep.
Yeah, that's true. All right. Thank you, sir.
Thank you.
That was nice of you. All right, everybody.
Thank you.
Thank you, sir. He's the best. Okay. So, that, Mr. Blige and I would do that a lot. That kind of stuff. Yes, Miss Trotter.
So what I've done before is like I would like grab from the other side and just kind of like pull and like use my body weight to like pull it back and kind of like stretch out their hip. Is that a good thing to do too? Or
Oh gosh,
would you
yes.
say, like,
Oh gosh.
kind of like just let my hand kind of like pull back as more.
Yeah. So what you just described is a move that I do at almost every massage I've got. I'm just throwing in something extra if you're like, oh, like if Mr. Bliging came in and described that problem, I might throw in some extra stuff. But yes, the move you're doing I think is fantastic. I do it every massage. because I believe in loosening up the gluteals, all of them. Yeah, and I love that. So I always work below the crest. I work above it too, but I always work below the crest of the ilium. And by the way, everybody, in general, you can apply about twice as much pressure below as you can above. Think about it. Above, it's kind of sensitive. Above your hips, you know, in this nice fleshy, on some of us flabby area. Below, it's all muscle and things like that. You can actually go harder below than you can above. I'm not saying go crazy either place, but you can go much harder below than above usually. Above's kind of sensitive, so yeah. But anyway, yes, Ms. Trotter, that's fine. And not only is it fine, you keep doing that. Yeah. So that is the gluteus medius, right? And the reason I said it's kind of like the deltoids of your hip. Your deltoids can do an abduction, your deltoids can do a flexion, your deltoids can do an extension, and this one can too because of all the fibers going different directions. And I look at, you know, hips and shoulders have some similarities. They're both ball and socket joints. They both got a lot of movability, just like we're going to find out feet and hands have a lot of similarities, right? And if you think about it, how many bones are in your forearm? How many bones are in your leg? How many bone is in your arm, your brachial region? How many is in your thigh? Hip joints are ball and socket, arm joints ball and socket. It's almost as though one area of your body adapted for walking and the other one adapted for doing this stuff, manipulating stuff. Yeah. But regardless, they're very similar in that sense. Yeah. Should we take a break? Is it break time? It's 4:28. Yeah? Ms. Mejia says yes. Yep. 15 minutes, everybody? All right. Ms. Charles says, yeah, it's okay. All right. All right, I'll see you back in 15 minutes. We'll be back at 4:43. 4:43. Thank you, everybody. Okay, just to make sure we got everybody still with us. Mr. Brown, what are the three gluteal muscles?
Gluteus maximus, gluteus medius, and gluteus minimus.
Thank you very much, sir. Miss Allure, which gluteal muscle is most posterior?
Maximus.
Thank you, ma'am. Miss Walker Y, which gluteal muscle is most anterior?
Minimus.
Thank you, ma'am. Miss Munoz, which gluteal muscle is most lateral? And its main action is causing abductions of the hip. I don't know if I asked that very well.
The medius.
Yes, that was fantastic. Thank you. Awesome. Okay, good. Okay, so we got max, med, min, extension, abduction, flexion. Yeah? Yeah. Plus a whole lot of other little stuff. I know. Okay, so let's go on and look at gluteus minimus. Gluteus minimus, by the way, here's the other thing to kind of think about. Not only are you kind of going from back to front, but you're kind of going back and down a little bit because the gluteus minimus is actually underneath the medius and down a little bit. So let me show you a picture of that, if we can pull it up here. There we go. So in this diagram, as Ms. Walker T always points out, I think that we have to kill somebody in every class. This person's a goner because we've cut through the gluteus maximus here, which partially covered the gluteus medius, which really covers the gluteus minimus. And note that the gluteus minimus can reach in front here. Now I realize it can cause an abduction. I get it. I'm not denying that for a second. But usually when I'm dealing with it, it's because of an anterior tilt of the hip, and so I care about the fact that it causes a flexion. But it's on the side too. It causes an abduction as well. It is hooked in front, so it can actually cause a little bit of a medial rotation too, which isn't surprising, but again, not something I'm terribly worried about. But anyway, it's involved in that kind of stuff. Yes, Ms. Sarno, please.
It can cause bending, hip bending or not?
Wait. Oh, it causes the hip to bend?
Yes. bending back on
Oh, to the side? Yes. Yes.
It can for that too?
Yes, it can. That and the gluteus medius. But let me be really clear, everybody, because we're going to start getting very precise about actions. Oh, this is not very helpful. Let's see if I can go a little bit middle here. Okay. This is me bending where I am laterally flexing my spine, right? My hip is abducting here, and I can bend at my hip, but that's me bending at my hip as opposed to me bending my spine. But yes, it'll bend at the hip. It will. Yeah, absolutely. Yeah. But we still call it an abduction of the hip. Whereas the stuff with my spine is lateral flexion. But yes, it can. Absolutely. And this is something else to think about that your gluteus medius and gluteus minimus do. And it's really important. When I walk, I have to lift this leg up to step forward, right? Well, when I lift this leg up, I'm terribly imbalanced. My body wants to fall over this way. Now, I've been doing this for 52 years, so I'm pretty good at staying up, right? But what is keeping me from falling over this way right now? Anybody? I mean, balance, yes, but what muscles are keeping me from falling over this way?
Your adductors?
No, actually my gluteus medius and minimus. Because they're trying to kind of abduct me back over here so that I don't fall here.
So the the gluteal muscles are contracting?
Yes.
To keep you?
Yes, exactly. So I know you don't see any movement. There is no movement. But they are contracting right now to keep me from falling over this way. If you think about it, this is really hard to imagine, but this is my right leg here, the one that I'm standing on. If you think about it, as I go this way, it's actually adducting. This way, it's abducting. And so I want to adduct and fall over, but my hip flex, my abductors, my gluteus medius and minimus, pull me this way and keep me erect. So when I lift up this leg, they pull me this way and keep me erect. Obviously, they don't overdo it, so I don't do that, but that's what they do. So you use them every step you take. Yes, sir, Mr. Blygen, please.
So for dancers or people that really focus on balance, like ballerinas and stuff, I noticed like when they'll do like those leg lifts where they can keep their whole like right side of their body stiff, where the left leg goes all the way up to their ear. Is that typically what's happening there? Like they've strengthened the opposite side enough to where it can contract enough to keep that whole side of the body controlled, while the other one is abducting?
Yes. Yeah.
Okay.
Yeah. And I'm sorry, you're actually right. There's no actual movement occurring there, but my body is abducting to keep me from falling over. It's tightening up that side. You're right. And that's exactly what they're doing, sir. They're probably doing 400 other things. There's all sorts of core strength involved. But yes, you are right. That side of the body, because the minute if you're a two-legged stool here and you lift up a leg of the stool wants to fall over this way. So those things help pull you back that way. Yeah. That's exactly right. And this muscle too, the gluteus minimus, inserts into the greater trochanter also. Greater trochanter is extremely important for this reason. Yeah. Okay, and I think, I do like these pictures in your book. This is still a posterior view. This white part here is actually like the sacrotuberous ligament and sacroiliac ligament. But anyway, these red parts are the insertion for these muscles. You can see the maximus coming down here and grabbing on to the gluteal tuberosity and down this linea aspera here. And you can see the medius grabbing on top and the minimus kind of trying to grab on to the front here. Oh, there it is, the minimus over here trying to grab on the front. But it gives you a good idea of how important these attachment sites are. And remember, the bigger the bump, the more stress that's probably put on that area. The bump doesn't make more stress, but like Mother Nature, God, Gaia, Darwin, whoever you believe in, made that bump extra big to be a lever to grab onto powerful muscles to move your body around. And if you think your shoulders are under a lot of pressure, your hips are under 10 times more pressure, right? They have to move your body. And that's why the greater trochanter is so big. And so often, by the way, when I'm working hips, I try to work them up here below the crest of the ilium, but I also try to work around the greater trochanter to release all these insertions. It's an oversimplification, but massage tends to really get better when you emphasize origins and insertions. Don't lighten up, don't fizzle out at the end of your moves and the start of your moves. Start strong and strong. They should start and end strong, just like you guys will in this course. Yes. All right. That is that. Yes, that is that. Okay, any questions about the 3 gluteals? Pretty basic. I'll tell you some cool things about hips. If you go from the back, you got your gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata, and then rectus femoris, really. Don't get me wrong, the sartorius is in there too, but glute max, med, min, tensor fascia lata, rectus femoris. So just tracing around somebody's hips from front to back or back to front, you hit 5 really, really important muscles that have to do with a lot of hip action. And many massage therapists are terrified to work in this area. I don't know if it's too close to the reproductive area or whatever, but it's not. And so get good at working this. Most therapists are not good at doing hips. And yet think about it. Like if you're a structural massage therapist, what is the center of your body? It's not your shoulders, it's your hips. And I feel like, you guys probably even remember this from class. Until you've had your glutes worked, you don't really think about your glutes. But the first time you've had them worked, you're like, what have I been missing my whole life? Like, forget about these shoulders, right? Shoulders is what everybody complains about. And, you know, and most massage therapists are good at it because they're there and they work them and they're easy. I don't mean they're easy to work. They're actually challenging, but they're common. We get good at shoulders. We get good at back because that's what we do all day long is shoulders and back, shoulders and back. We're not good at hips, right? We're not good at glutes and stuff. So play with that stuff where you're ruddering the leg around, digging around in there. And there's so much there. I just listed 5 muscles that go around there, but then underneath those 5 muscles are the deep lateral 6 hip rotators. It's the deep 6 or the lateral hip rotators. I like to put them together. Anyway, so that's 11 muscles that are pretty key there, and the sciatic nerve runs through there, and that's how they balance, and that's how they walk. And if anything's messed up down there, you can forget about everything upstairs, like the back's gone. There's no way the back can be good and the hips are not good. So it's just not a crazy area to spend time on. It's also, you know, the glutes are the gluteus maximus, the most powerful muscle in the body, probably. All those reasons. Really, really want to look at the center of the body, and that really is the center of the body. Cool. Okay. If there are no questions, I'll release homework. Let's see. So for homework, you've got a short test on test 50 on glutes. I think it's only 15 questions. And then you've got your matching from chapter 13 on reflexology. We will be talking about reflexology tomorrow, which I'm pretty excited about. Yeah. So you've got a test on the glutes here, a short one, and then matching for reflexology from chapter 13. They're both due tomorrow. That's 2 things that are due tomorrow, right? Glutes and reflexology. And that's it. I'm here to answer questions, all that good stuff. You know the routine. Yeah. It's good to have you guys back. It's kind of good to be back in like I don't know, swing of things. Yeah. Cool. All right, everybody. I'm here if you need me. I might be in and out, but you know, I'll be here.